I just wrote down your blood pressure.
Yeah.
You need to go to your doctor and get your cholesterol values, your blood sugar, and you can write down your weight
This is for
there.
me,
That's
forever
you,
and
that's
ever?
for you.
Oh, this is great.
It's
Okay.
part of our program called Lifestyle Intervention Forever. And I find it very difficult to give all the proper information in the way we practice medicine at this point in time, because what we do as heart doctors is we are dealing with people who are quite sick.
Yeah.
So what we do is actually once a month, we meet over at Ryerson Church called the Life Project, called Lifestyle Intervention Forever. And as we talked about before, the best way to treat a heart attack or a stroke is prevent it happening in the first place. Is that most of us plan our retirement, but we don't plan our health retirement. And to stay healthy takes a lot of effort. And for instance, if you look at diet, for instance, the average North American is eating over 110 pounds of sugar per year, translation to over 40 teaspoons of sugar per day.
So if your pulse is good, if your blood pressure is good, if cholesterol is good, the chances then of a heart attack surely are minimized.
No. I mean, the answer is what you're saying is that it's improved. But what you see on the surface, what we care about is what's happening in the vessel itself. And unfortunately, we don't have good ways of predicting who's going to have a heart attack or stroke on an individual basis. We know this disease is a silent killer. For instance, we're born with normal arteries. This disease starts very early in life. In fact, it starts the day you're born, and it progresses. Most of us don't have heart disease till 40s, 50s, 60s, 70s. What we now realize is that heart disease is occurring 10 years earlier per generation. It's a bigger problem.
Well, 4.5 years ago, I got a quadruple bypass done, and 2 years later, it went off at a very rapid pace. So my call today is, I was very glad that you were at the general at that time, at the emergency, and you slowed it down. I want to thank you very much, because I never had a chance to thank you then.
Lovely.
Walter, recognize the voice. It's very kind of you. And you keep healthy now.
Lovely. Walter, thank you for that. That's a wonderful thing. These gentlemen do marvelous work.
What was it? This is 98, huh? Wow. So back in that, when in 98 we hit that, what, remember what month that was roughly?
I'm not sure. It was
Doesn't matter.
before I saw Dr. Perez, and I started seeing him in the spring.
6.83, wow, that's good. Your triglyceride was 1.79. And 1.55. Good detective work. Were you taking any medications back then at all?
That's before I
Yeah.
started, and then he put me on Provocol, and then it
Right.
stopped working, so now I'm on Lipitor.
Right. So I'll put that, that's great. Can I keep these notes for my chart here?
Yeah, you can keep those.